What is PDCET exactly and what is the eligibility for it? Is PDCET repetition of DTCD again? So this is what I tell to my DTCD students. Say MD people take 3 years, but DTCD people do the same thing in 2 years. How did you prepare for that PDCET? Many by the time they get into secondary TNP must have been married, and especially females. Is there any provision for maternity leave?
You are like an icon in this pulmonary medicine. No, PDCET actually is not mandatory. Exam structure, usually it is 120 MCQs. Resident pulmonary course played a crucial role in concept building and exam orientation. Is Dr. Raghav sir, I would thank him also. Exam of PDCET. It's all about how you apply the theory which you have learned for PDCET.
After DTCD, many doctors have a doubt how to prepare for PDCET exam. Thank you, Dr. Mohit. You have given a wonderful explanation for each and every question. Some are seeing matches for life partners.
So now, you also must be seeing matches. So this is your personal question.
Welcome all. I am Dr. Ishwar Narayana. I am a DTCD doctor, chest physician. Now, we are making this video especially to enlighten you about PDCET exam. Because after DTCD, many doctors have a doubt how to prepare for PDCET exam, whether PDCET is necessary, and lot of doubts about PDCET. To answer all these questions, we have Dr. Mohit, who is our guest speaker. He secured All India third rank in PDCET in 2025. And our beloved teacher, eminent faculty of respiratory medicine, Dr. Bharat Katti sir, will be leading the show. Hi, sir.
Yeah, thank you, Ishwar Narayana, for the wonderful introduction. As I always say, it is my honor and pleasure to always speak with my students. So, Dr. Mohit, I have known him for the last 2 years. He's very hardworking, sincere, and right from the word go in DTCD, he has created so many wonders. Last time when we met in Absacon, he has done a beautiful poster presentation, and he was also one of the winner in the quiz competition also. So now what we are going to do is, for the benefit of all students, we will see how to approach to PDCET exam, what are the sources to be followed, and life after DTCD. So welcome, Dr. Mohit.
Good evening, sir. Namaste. Thank you so much for giving me this opportunity to speak to my fellow colleagues and juniors. I'm feeling very honored and privileged sharing the platform with you, sir. You are like an icon in this pulmonary medicine. From day one of my DTCD, I've been hearing about you. Later on, during my FAT exam is the one when I started the DAMS course, residency course. So from there the journey started, and I don't know if I would have been reading only the books. Fishman, I was reading. Maybe I read around twice during my DTCD, but I couldn't. Simplify as you have simplified it to us.
So thank you so much, Dr. Mohit, for your kind words. Now let us start the questionnaire. It will be straightforward, simple. I want you to guide your juniors. What is PDCET exactly, and what is the eligibility for it?
PDCET is actually a post-diploma centralized entrance test. It is conducted every year, once a year, by NBMS, and it is like a gateway to secondary DNB, which is also called post-diploma DNB. Eligibility is, as we are in pulmonary medicine, it is DTCD, and you need to have a permanent registration beforehand during the application process.
So is PDCET mandatory for a person to become a pulmonologist? And can DTCD doctors practice independently without clearing PDCET?
No, PDCET actually is not mandatory. DTCD diploma holders can practice independently and they can do bronchoscopies, they can work in ICUs, they can do pleural procedures. Uh, Based on the experience and the training and the exposure which they have received and the competence which they have, they can practice independently.
Is PDCET repetition of DTCD again, the training part, or any new things that you're going to learn?
So I think exam perspective, PDCET is a clinical MCQ based examination that evaluates application of theoretical knowledge, clinical reasoning, and decision making. Training perspective, secondary DNB institutes are usually higher volume centers where you get to have a better structured ICU, sleep medicine, more advanced procedures like EBUS and other things. The syllabus is substantially overlaps because the board never delineates. It tests the depth and knowledge and application of the knowledge. Uh, Knowledge overlap exists, but skills, confidence, and academic orientation impose substantially.
See, this is what I tell to my DTCD students. Say, MD people take 3 years, but DTCD people do the same thing in 2 years. The only difference I say is thesis part. Apart from that, the
Hmm.
curriculum, the effort that you have to put is the same. Now, my next question is, what about research during secondary DNP?
Yeah, the research actually, the thesis is mandatory and integral part of the DNB curriculum, and it is monitored. It is protocol driven, and it is monitored by NBMS directly in stages. And moreover, DNB institutes, the consultants and the hospital will encourage you to publish some papers that will eventually strengthen your CV for later on in teaching purposes or corporate hospitals role or fellowships, joining fellowships.
Now, the main question of the day, how is PDCET exam structured and how did you prepare for that PDCET and what made you to get that single digit extraordinary rank?
So thanks to you, first of all. Then exam structure, usually it is 120 MCQs, computer based, just like NEET PG. There will be native marking, and usually it is clinical scenarios. And the exam, usually they test you about the way you interpret, the way you apply things and management decisions. Uh, Mostly, any MCQ examination, I feel the main strategy would be analytical thinking. How you are ruling out the wrong option, deeply analyzing the options, and this is the thing. And the topics, discussing the topics, TB is the core. I feel guidelines, newer guidelines are coming, newer tests and diagnostics, newer regimes are coming. So vaccines and ILD, where you have the HRCT patterns and clinical radiological correlation, how do you correlate lung cancer, where staging, diagnostic molecular markers and treatment algorithms, and coming to the airway diseases like asthma and COPD, we follow the gold and GINA and gold guidelines, pleural diseases, and PT, pulmonary thromboembolism. Some questions on sleep, but you should be good at ABG, ICU like ABG, PFT interpretation. I think these topics are main for the preparation.
So I'll take all these inputs into consideration, and the next grant test that we are going to upload will be containing all these topics definitely. Now the next question, how did resident pulmonology from DAMS help you in your preparation, and how did you solve MCQs?
It was very extremely useful. Resident pulmonary course played a crucial role in concept building and exam orientation preparation. I'm very thankful to you. The way you made complex pulmonology topics simpler, clinically intuitive, and easy to retain. The course contains clear explanation of all the core pulmonology topics, revision modules, OPDs. OPDs are very awesome, sir. When you start revising at the last day, it will be very useful. OPDs and MCQs were nice. The most important strategy, as I told you, it is analytical learning, deep analysis of incorrect options, understanding of why an option is wrong, not just why one is correct. Learning systematic option elimination. This analytical approach is particularly well thought and emphasized by you and Yashaswini ma'am, sir. I would like to thank ma'am also through this platform.
Now going to the next part, let us dwell into the secondary DNB residency. Few questions that students have asked me. How many days of leave you get during secondary DNB training? And many, by the time they get into secondary DNB, must have been married, and especially females. Is there any provision for maternity leave?
Usually 30 days per year as per their guidelines, excluding day offs and week offs. That depends on the institute. Some might not prefer giving them day offs, so it all depends on the institute also. And maternity leave structure is also based on the state rules and national rules. In some states they give up to 26 weeks. That should include the day of delivery also, as per the NBMS rule book. And though it is they give the leave, but training will be extended accordingly. Marriage or pregnancy is not a barrier, I think, for doing.
Yeah, great. Again, secondary DNB is also 2 years. How are the exams and the course structured here, and how has been your journey right now? Because you are studying in one of the premier institute of the country. I know the faculty there, they are really extraordinary people, and you must be very fortunate for being trained under them.
Yes, sir. Actually, secondary DNB, I have come from St. Joseph Hospital, Guntur. I did my DTCD there. Though my faculty is very senior and is Dr. Raghav Rao, sir, I would thank him also. And on this, but the procedure wise, it was not that much advanced uh, hospital. But coming to NIMS, after joining NIMS, we are able to see the volume, a huge volume of patients. Before one patient leaves the bed, the other patient will be ready. So, and procedure wise, it's very good hands on. We have very eminent faculty as Dr. Paramjyoti sir and Dr. Narendra Kumar sir and Dr. Rakesh sir. Now Dr. Ram Bhukwal Reddy sir has joined recently. So a combination of both very experienced teacher, professor, and super specialty sir. So it's nice, sir. I'm happy to be here.
Yeah, happy parties. Dr. Ram Bhopal was my postgraduate when I was working as senior resident. Okay, next question. Is secondary DNB necessary for getting private or corporate jobs? Does clearing PDCET significantly improve your job opportunities and salary?
Secondary DNB is not mandatory, but provides a clear advantage, sir. Because smaller hospitals are tied to cities. You can the DTCD diploma holders can practice very easily, and if based on their competence, the salary will also be high in tied to cities. But then coming to the major cities, there and the bigger corporates will be there where they prefer DNBs more than DTCD. UTCD people, they take them as intensives. Accordingly, the salary is also negotiated.
How many seats are actually available for PDCET? I mean, a DTCD candidate who wants to take secondary DNB training, and how is the competition right now?
So when I gave the exam, around 100 people appeared, and there were around 50 to 60 seats. Now the seats of DTCD has been increased, so I'm thinking some around 100 to 150 will be right in this year, and the seats are also not that increased, maybe around 70. So it's not that tough to clear the PD set, but when you want a good institute among them, then you have to be very focused.
How to choose the best PDCET institute?
Best PD set, sir, as per my research, when I did research, there are institutes with reputation. I would prefer first. Second thing is the patient load, where there's high volume of OPD and bed strength and good hands-on. And fourth is very experienced faculty who can teach you in and out from the basics. And the fourth and fifth one, I think it's stipend.
So, what is your advice for DTCD students right now who are preparing for their final exam and also PDCET?
Don't I feel we should not combine those two. DTCD, when you are given a theory, that is a theory exam, and the core concept should be clear. The theory should be perfect. And when it comes to the exam of PD set, it's all about how you apply the theory which you have learned for DTCD, like clinical based scenarios. So ABG's interpretation, PFTs, and lung cancer. What do you do next? So that is more important. How do you approach to the patient is more important in PD set.
Thank you, sir. Thank you, Dr. Mohit. You have
Thank you.
given a wonderful explanation for each and every question. And from my side, I have one question because my friends, my batchmates, and many people who are preparing for PDCET now, they have a question because they all are stuck in some jobs. Some are seeing matches for life partners, and some are not yet started for preparation. So now,
You also must be seeing matches. Ishwar. So this is your personal question.
sir, Dr. Mohit, my question is, as exam date is given as April 12th, if we start now for preparing PDCET exam, is the time is sufficient?
Yes, 100% sufficient. You can clear it very easily, but thing is, you should be very focused
Okay,
uh,
thank you.
because you have just cleared the theory exam. So I think you should keep on that. I mean, you should try to maintain on the theory exam whatever you have studied. It should be continuous, not that you have taken some gap now. Again, it will be a new beginning. Then it will be a trouble.
Dr. Mohit, this is a good answer. I will also follow this. And one more question I have. My friends also asking, because they did not subscribe to any other academic coaching apps or anything. What do you say with your experience if I ask for any single best source for preparing PDCET exam, especially for
See,
DTCD doctors?
actually, in my preparation for PDCET, I thought I'll search for some books like NEET PG nowadays. Though it is not legal, they release some MCQ books. But through online, I searched, but I didn't find any book completely based on this MCQs, except for those MRCP books where respiratory medicine questions will be there. But so I feel you have to take some platform. Dams would be the best. I not saying because talking through this platform, but because I've seen many people cracking this exam due to that.
Thank you, Dr. Mohit. And one last and final question from my side. So, which topics? What is the spectrum of the topics we should majorly concentrate for PDCET exam?
One is lung cancer, I would feel, and ILD, because they can corner you to any extent. If easy to difficult, we can make questions out of it. Lung cancer and what is ILD. But TB is straightforward. I feel they may twist you, but if your clinical judgment and the regimes which you have read is okay. I mean, sir has taught about how to manage by child pulse score. You want to give two hepatobiopsy and one like in that way in renal. So this is what they ask. So I don't think that would be a major problem. Major thing would be lung cancer and ILD. Rest everything is and interpretation of PFT. Last time I think they have asked me one PFT with DLCO, so that you should know. Those are the basics, and you should not blunder on basics.
Exactly.
One thing I would like to add is
Definitely.
the tables in Fishman. I think they are also very helpful. If you make a list of all the tables in Fishman and lights also, they have mentioned some important points, lights textbook. So these points before the exam, once if you can revise, that will also be very helpful. This is some add-on I would like to tell.
Thank you, Dr. Mohit. It has been a wonderful video. Definitely, this support is very much needed at this point of time for us. Thank you, Dr. Mohit, and thank you, Bharat sir. Because of you only, we would able to connect to the lot of doctors. You have established a very good network in the country, uniting all the pulmonologists and guiding us, supporting us. Thank you very much, sir. Over to you, sir.
So I'm very happy today to see, especially Ishwar. I have seen you as an undergraduate. I have seen you as a student in your residency. Now you have changed to guide for all the DTCD students. And this evolution and transformation, it should be an inspiration for everybody. Because you are from a very humble background, as far as I know. And you stood only by your confidence and your hard work. And confidence, hard work should be the guiding principles for any resident. And that confidence and the amount of hard work you put in today will definitely bear you greater fruits tomorrow. So to conclude, Dr. Mohit, it was a great session speaking to you, and your inputs are very valid. And I think this should be the guiding principles for all the DTCD doctors, so that they can clear their theory exam, and those thinking to write the PDCET, whatever Dr. Mohit has told, these are the golden points that you need to follow. So thank you so much, Dr. Mohit. Once again, it was my pleasure to see my student being in such a premier institute, and looking forward for you to be one of our guiding faculty for all the DTCD students and later to our residents. So thank you, Dr. Mohit.